So we're moving to the next types of amputation. We're in orthopedics, so we'll talk about very crazy and scary things. Okay, so we'll talk about amputation. Amputation, you are trying to cut somebody's body parts. Yes, you are trying to cut somebody's body parts. So we're talking about the upper arm, and this is the upper arm, right? Upper arm amputation. They will also talk about the transfemoral amputation. So transhumeral, you are cutting the humerus bone of the upper arm, while transfemoral actually cutting the femoral the femoral bone, okay, of the lower limb. You understand? So you are cutting somebody. So what it means, we'll discuss them one by one. So as a mode of introduction, we said that transhumeral and transfemoral amputations, they are major limb amputations. So they significantly impact the way the person will now be moving around and the way the person will now be doing their daily activities. Of course, if you cut my hand, okay, some things that I would have done with my hand, people have to help me. So these surgeries, they mostly impact the patient psychologically. Do you understand? So before you do it to somebody, you should always weigh the benefits and make sure that the benefits is more than the risk. All right, because I've never ever seen somebody that they amputated one of their leg or hand that their life is complete again. You understand? Patients usually feel very sad about this. So for the transhumeral, it's just a surgical removal of the arm above the elbow joint. Okay, that's through the humerus bone. Okay, so common causes, that's common reasons. Common causes. I'm not actually understanding this. The causes here are also risk factors, because you could get an injury and the arm is removed like this. There's sometimes you might get an injury that the arm is damaged to an extent that the hospital has no option than to remove it. Are you getting the difference? Severe infections is a reason why they might actually remove your hand. Vascular disease or cancer affecting the arm is a reason. So this is not common causes, these are reasons, right? Reasons why they will actually want to remove your arm in the hospital. So prosthetic options: body power prosthesis, myoelectric prosthesis, passive cosmetic prosthesis. Okay, so this one, they're just trying to tell you that after your arm is removed, okay, how can they compensate you? So moving forward, rehabilitation focus is shoulder mobility, strength, learning prosthetic controls, psychological adaptation and support. Then moving to the transfemoral now. Transfemoral is just surgical removal of the leg above the knee joint through the femur, that's the thigh bone. So common reasons, again, it's not causes. So they might be removing your knee, your leg above the knee joint, simply because you had severe trauma, peripheral vascular disease or diabetes complications, bone tumors or infections. So prosthetic options, after they remove that, they can compensate you by giving you a mechanical leg, microprocessor knee, hydraulic or pneumatic systems. Then they can now rehabilitate you to restore your hip strength, gait training, and fall prevention. Okay, so that's just it for these two types of amputations, just so you know.